Stroke or paralysis, you must have heard a lot about it in Google and YouTube, right? Let me tell you in brief. What happens is that a person loses its ability to function on one side completely voluntarily. Imagine, I'll give you an example. Imagine that you're going to pick this bottle of water. If I want to pick up from the side of paralysis, I won't be able to lift it up, either because of wasting of muscle or there is weakness of muscle of one side completely. And the other side, which I have noticed, like in cases of stroke or paralysis, is that patient normally neglects the side of paralysis. So they ideally do not do any kind of activities, or even if they look at this side, they feel that there is nothing actually in this side. So when we get into the physiotherapy aspect of treating a stroke or paralysis patient, our main goal or target would be firstly to target the side of the injury, or where he's not able to perform the activities, which is either right or left, depending on which side of the brain is involved. Imagine that you have got the right side of the brain is involved in stroke, you're going to have left side paralysis. But if it is left side, it's the opposite. So it's always the opposite side which is affected. When it comes up to the psychological aspect, it's not just about the psychological aspect, I would say. Even the cognitive function, as well as the emotional aspect when it comes to stroke patients, as they are not able to do or perform any activity which they were able to perform initially, and all of a sudden it just goes away. It gives a huge impact on their emotional aspect as well. So they go into depression, anxiety, they don't talk to much people. So it's when you're treating a stroke or paralysis patient, it's not just about the physiotherapy aspect, it's about the emotional aspect as well, about the cognitive aspect, everything. So it's like a multidisciplinary approach. We have to take care of how they're eating, how their emotional status is, how well they're performing in terms of exercises. Because most of the time what happens is that a patient's aspect is that he would only do exercises within 24 hours in physiotherapy department, but while going home he will not do anything. Imagine it this way, that you have 24 hours in the entire day and you just do 1 or 2 hours of physiotherapy or physical activity in a day, and you think that with that 2 hours of activity you're gonna have good results. That's not true. Imagine that God has given us 3 times meal, right? Is even if you eat 1 time meal and you think the other time you're not gonna eat, your body's not gonna have enough amount of nutrition. So imagine that within 24 hours you're having these many meals so that you get nutrition to your body. And if you've got stroke and you're just doing exercises for 2 hours, or let's say 1 hour for say within the 24 hours, and you're expecting a huge result, that's not going to happen. So you have to be very consistent first of all, and repetitive movements or repetitive doing the same activity on a regular basis registers in your brain as well. Imagine that when you've got a stroke, you are like a small baby. You are learning all those few steps, from crawling to falling down, again getting up. All these are basic life functions which a baby follows. The similar aspect is done in a stroke or paralysis patient as well. My biggest struggle, okay, a very good question. It's very subjective, I would say. For some people, it would be lack of confidence. For some people, they want to achieve just one movement which they could say would be a very life-changing for them. I'll give you an example of my MS patient. She's not able to walk. She's able to drag, I would say, with assistance. For her, main goal would be just lifting her ankle. And once she feels that once she lifts her ankle, she'll be able to walk. But that's not the scenario. You have to strengthen the hip, knee and ankle together. So this is a very good example, I would say. So it's very subjective in terms of what a patient needs. So each challenges and each patient has its own struggles, I would say. Well, my go-to message for all kind of stroke or paralysis patient would be, first of all, would be never lose confidence. Second would be never think that only physiotherapy is your go-to thing, right? It's like a multidisciplinary aspect. You need to have good amount of emotional aspect, good amount of diet as well, and a very lively environment at your home. Because most of the time you're going to live within your home. You're not going to live within the physiotherapy department. So how well you are in that particular scenario, that makes a huge difference. One last word. If you have anyone near you, maybe your father, mother, your relatives who has or who's suffering from stroke or paralysis, never isolate them. Give them the emotional, what can I say? The good word would be a support to them so that they recover on a much faster level, not just physically, but even mentally.